I would say not.
Good morning, everyone. It's December 28th, 2021. I'm now going to call the McLeod County Board of Commissioners to order. We'll start by the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Good morning again, everyone. We'll start with consideration of the agenda items. Is there any additions or corrections?
No changes, Mr. Chair.
Is there a motion to accept?
Second.
Motion made by Commissioner Luthens and seconded by Commissioner Wright. Any discussion? Hearing none, we'll proceed to vote. All in favor of approving the consent agenda, the agenda items, say aye.
Aye.
Aye. Opposed? Motion carries. Consent agenda. Any additions or corrections to it? Hearing. Motion made by Commissioner Nagel and seconded by Commissioner Luthens. Is there any discussion? Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Aye. Opposed? Motion carries. COVID-19. Barrett, good morning.
Good morning. So my update for today, as of yesterday, December 27th, McLeod County has had a total of 7,869 positive cases of COVID-19. This is an increase in 130 new cases since last week when I was here to report. There have been 267 new cases in the past 2 weeks. 10 of those cases were cases of reinfection of COVID-19. Of those new cases, 11 people needed to be hospitalized. There are currently 90 active cases that require isolation, and 15.7% of the new cases in the past 14 days were children under the age of 17. Unfortunately, we have had 92 COVID-19 related deaths since the start of the pandemic, which is 6 more since my last report, which was just last week. As always, the COVID-19 dashboard is updated weekly on our county website homepage if you have more questions or are interested in more statistics. The message that we are hearing continually on our calls with public health and other state agencies is that we need to kind of hold on and stay the road because the next couple of weeks or couple of months is going to be pretty tough with the Omicron virus. Omicron spreads more easily than other variants, including Delta. It does not seem to cause more severe illness or death than other variants. However, with more infections, we could still have many people with severe diseases leading to hospitalizations and even deaths. We do continue our vaccination efforts here at the county. We have held 83 vaccination clinics to date and administered a total of 10,517 doses. We have one clinic this week on Thursday, the 30th. Again, please see our website if you are interested in signing up. We will be offering Moderna and Pfizer for all age groups at that clinic. Any questions for me?
For Barrett? I have none.
All right. Thank you.
Thank you.
Happy New Year.
Happy New Year to you as well. Employee relations, Hannah.
Good morning.
Good morning.
I have a few items this morning. Item A, consider approval of the Personnel Committee and Evaluation Committee recommendation to add and post for the Health and Human Services Administrative Assistant position, which is graded a 130. The Health and Human Services, or HHS Admin Assistant, will provide administrative support to the Health and Human Services Director, Health and Human Services Administrative Team, and other staff within the Health and Human Services Department. This is a new position that had been requested by the Health and Human Services Director. I should note there are a few other positions like this in the county for positions like the Health and Human Services Director.
Mr. Chair, I just want to add a couple of things with this request because I know there's been some questions. We used to have an office manager in Health and Human Services that assisted the the Human Services Director, and we've also always had administrative support when we had just a public health director when we had them split up. This fits pretty well into combining those two departments and assisting the Director Barrett with some of the responsibilities that take up quite a bit of her time. This person would be able to help her
pass along some of the tasks so that she can focus more on her leadership groups. Thank you.
Well warranted, move to approve.
Second.
Motion made by Commissioner Wright, seconded by Commissioner Nagel to approve. Any more discussion?
Just real quick, this is the time of year that we've asked the department heads and administration to look at new positions or less positions if possible, so I appreciate that we didn't have to, that the timing was as we asked.
I do as well, Commissioner. Any more discussion? Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Aye. Opposed, motion carries. Next.
Item B, consider approval to decrease one full-time public health nurse's hours from 80 hours per pay period to 64 hours per pay period. This requested decrease is in response to workload decreasing due to a school contract not being renewed in 2022.
Thank you for looking at that and bringing it to the board. Move to approve.
Motion made by Commissioner Nagel. Is there a second?
Second.
Seconded by Commissioner Smalls. Any more discussion?
I'm just gonna add, and I'm not gonna get in the way of approving this today, but there was a time where we were either full-time or we were non-benefits eligible. And so I'm just gonna throw that out there to monitor that, but it's not something I'm gonna, again, throw in the way of today's motion, so.
I have some of them same concerns, Hannah, but I'm the same. I looked through the whole packet, and I think our people are doing a good job of, lack of a better word, getting lean and mean, and that's, in today's work environment, I guess that's important.
And just so you know, that was something we did discuss both with finance director and talked with Barrett about that too. So definitely something we're thinking about in these types of requests. Thank you.
Any more discussion? Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Opposed, motion carries. C.
Item C, consider approval to increase the current public health nurse from 56 hours of pay period to 80 hours of pay period. This will be an increase of 24 hours per pay period or 12 hours per week and a yearly financial impact of approximately $19,000 a year. This role will allow McLeod County Public Health to have a specific staff person dedicated to emergency preparedness, or EP. Currently, there is an EP coordinator for all Meeker McLeod Sibley Community Health Services, or MMSCHS. Additionally, the role would be an emergency preparedness / disease prevention and control coordinator and backup immunization coordinator. There is a workforce development grant that is able to fund these additional hours, so there will be no budget impact.
More questions for Hannah? If not, I can entertain a motion to approve.
So move.
Motion made by Commissioner Smalls. Is there a second? I'll second it. Seconded by Commissioner Kruger. Any more discussion? Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Opposed? Motion carries. D.
Thank you. Last item, consider approval of the Personnel Committee and Evaluation Committee recommendation to approve the full-time public health nurse, which is what we just, item from item C, the Emergency Preparedness, Disease Prevention, and Control Coordinator position, graded a 170. Again, this position will be responsible for planning, organizing, coordinating the activities for Health and Human Services response to hazard emergencies. These activities include education, communication, and collaborative efforts to prepare for all hazard response to emergencies, infectious disease outbreaks, and other public health threats. Because of the decrease of the public health nurses' hours, this will only be an increase of 12 hours, and again, that cost will be covered by a grant, which leads to no budget increase.
Mr. Chair, move to approve request.
Motion made by Commissioner Smalls to approve. Is there a second? Second by Commissioner Luthens. Any discussion? Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Opposed? Motion carries.
Thank you.
Thank you, Hannah. The next item is an item brought up by myself in the last few days, or week, 10 days better. I've been looking into some problems with some other counties and through Trailblazer and stuff to get veterans to their appointments, and as I was doing that, I talking with our service officer, and I noticed that our pay for our van drivers had not been addressed since 2011. It was set at that time by the commissioners. So today I did some checking with our personnel are with Hannah, our humans, Hannah and Sheila. And I'd like to today set the wage at $18.70 per hour. The base there is, we tried to look for now at a comparable wage within the county, and we came out with that figure, and I truly believe it's a fair figure. Again, it hadn't been addressed for so many years, and we're gonna address it with personnel to make sure it's on a schedule so we don't forget about it again. And again, I got here because some of the other counties around us are having really bad troubles with getting their veterans to doctor's appointments and other appointments, and we are actually doing pretty well, and I want to keep it that way. We have 5 vans, 4 regular vans, and 1 wheelchair accessible van. They're busy. We try to do something through Trailblazer, and state restrictions doesn't allow us to run into other counties, and I don't want McLeod to go that way. So that's why I'm bringing it up today. Jim, I notice you're here. Do you have anything to say about it, or are you good? Jim Lauer, for those that don't know, is our service officer.
Not something that we specifically brought forward, but we've been tracking what's going other places. Even the VA hospitals and the disabled American vets are having problems keeping up with the volume. Probably the biggest issue is our counterparts in Renville. They lost both of their drivers, one for health reasons and another for COVID restrictions. And they've had their positions listed since before Thanksgiving. With theirs is in a range that starts at 16, goes to just under 22, and they have not had a single application in that entire time frame. And all our sister counties are kind of struggling right now. We're doing well. We've got dedicated guys, but they do see what's going on around them.
What's the wage now? Forgive me for not knowing.
$16.73. And I think there's a move to get them put on an actual scale where there's a range here, possibly in the future. Personnel committee will talk about that. They've got a set amount, whether they're driving for 3 years or they've been driving since before I started. They're pulling the exact same rate. So that's
again,
just a little bit more background.
Thank you, Jim. And again, I'm very proud of McLeod County, their veterans groups, and the county has a veterans organization that has got money, we've got vans through them and some grants as well. And I'd like to keep it that way to serve our veterans here in McLeod County.
Mr. Chair?
Go ahead.
I'm not going to get away with this. In fact, I think it's a good idea, and I'll even make the motion in a second here. But, just make sure that we're aware of the process with the personnel committee and how I get this as a unique circumstance. That some information came to light in the 11th hour, and it's probably a good thing. So for budgeting purposes, that we can pay attention to that. So with that, I would move to approve the 1870 for the new wage, and hoping we can put it on the personnel schedule, structure it in the future.
Second, Mr. Chair.
Motion made by Commissioner Nagel and seconded by Commissioner Luthens. Is there any more discussion?
Just thank you, Commissioner, for bringing this up. It's kind of obviously a sleeper topic if we haven't addressed it since 2011, so thanks for doing that.
And again, I do apologize. All the points are well taken, and we'll work on it. It's something that just came up that I really wasn't aware of, and I just like to move it forward, so thank you. Any more discussion? Hearing none, we'll proceed to vote. All in favor of setting the veterans van drivers wage at $18.70 per hour, say aye.
Aye.
Opposed? Motion carries. Review of commissioners' calendars.
Pretty short this one.
Short week.
Yep, pretty short.
Short and fast.
Yep, nothing here either.
I don't as well. I had some phone calls I addressed. We had a meeting on broadband. We had a Zoom meeting with another broadband company, and we're working with that. So that's all I had. Joe?
A few phone calls, but other than that, just family time.
Yeah, it's great to have family time at this time of the year. And Since our last meeting, I believe we held a workshop on the 21st. And then yesterday, I had a CHB Finance Committee meeting that I attended and participated in. Thank you, Mr. Chair.
Thank you. Sheila, do you have anything?
I do not, Mr. Chair, thank you. Item A, notification of board workshop following the board meeting today, December 28, 2021, at the McLeod County Government Center, 520 Chandler Avenue North, Glencoe, Minnesota. Item B, notification of Health and Human Services Committee meeting to be held following the board workshop on December 28, 2021, today at the McLeod County Government Center here at 520 Chandler Avenue North, Glencoe, Minnesota. Item C, notification of board workshop following the board meeting on January 4th, 2022, here at the McLeod County Government Center. Thank you.
Thank you. Any other business that should duly come before this board? Open forum. I see no hands. I will say a belated Merry Christmas to everyone and wish everyone a Happy New Year. I'm excited, although we're in trying times, I'm excited to see what 2022 brings. Press relations, also not seeing any press, so with that, I would entertain a motion to recess our meeting until January 4th, 2022 at 9 a.m. here at the McLeod County Government Center.
Move to recess.
Motion made by Commissioner Smalls to recess. Is there a second? Second. Seconded by Commissioner Luthens. Any discussion? Hearing none, we'll proceed to vote. All in favor of recessing, say aye.
Aye.
Opposed? We're in recess. Thank you.